All right, I think we can get started. Good morning and welcome, everyone. It's August 1st, 2023. Can you believe it? I don't know what happened to July, but thank you so much for joining us. This is our monthly module, also sometimes referred to as Redetermination Series. But today we are going to be talking about Healthier Oregon. And I am so excited to talk about this topic. It has been a dream to be part of this work. My name is Maria Vargas. I am the communications strategist for OHA's Community Partner Outreach Program, also known as CPOP. And I'm joined today by my amazing colleagues. I have Jorge Martinez, Tanya Curel, and Janelle White. Jorge, would you like to introduce yourself?
I would. Thank you, Maria. Hi, everybody. Jorge Martinez, Community Engagement and Outreach Strategist for CPOP. It's great to be here today with all of you. Thank you, Maria.
Thank you, Jorge. And Tanya, would you like to introduce yourself?
Sure, thanks, Maria. Hi, everyone. Tanya Curiel. I am on the CPOP team, one of the regional outreach coordinators, and I serve Central Oregon and the Columbia River Gorge. If you have any questions, I'll be the one answering things in the chat, so you'll hear from me. Nice to see you all virtually.
Thank you for that, Tanya. And then we have Janelle White. Would you like to introduce yourself, Janelle?
Yeah, thank you. Hi, everyone. I'm Janelle White. I am a policy analyst with Aging and People with Disabilities Financial Eligibility.
Awesome. Thank you so much for being here as well, Janelle. Okay, well, I mentioned that this has been a dream to be part of this work, and I clearly still remember sitting in an ODHS office in Ontario and having people from the state come and give us a presentation on healthy kids way back in 2009. For any of you who maybe have been doing this work for a few years, you might also remember when that launched. And then I also clearly remember back in 2014 when Medicaid expanded in Oregon and we got rid of that lottery system that we had and more adults were eligible for OHP coverage. And then in 2017, we got this glimmer of hope with I'm Healthy and Soy Sano, where more kids and teens were eligible to get some health services at some health clinics, regardless of their immigration status. So for kids and teens that weren't eligible for health coverage because of their immigration status, they were able to get certain health services. And then in 2018, with Senate Bill 558, we had Cover All Kids, where yay, all kids and teens under the age of 19 were eligible for full OHP, also regardless of immigration status. And here we are in 2023, and I am so happy to say that we have a completely open Healthier Oregon program. And that means that in the state of Oregon, immigration status, citizenship status, no longer determines whether anyone of any age, is eligible for full OHP. So I hope you take a moment to celebrate. I use this image of a mountain because I think it's a good representation of what it has taken to get here. So many people for decades have been advocating for this, have been working towards this, and we couldn't have done it with all of you, our community partners who work so hard every day to help connect people with the different things they need, not just health coverage, but so many other things that impact their health. So I just thought we would take a little hike through the history of how it is that we got here. And I am overjoyed to be here and to be part of this moment in history. So today we're going to talk a little bit about the background of how we got here. Very high level. Don't worry, we're not going to go into too many legislature details, but we will talk a little bit about it. We'll talk also high level eligibility. Want to make sure that everyone is aware of what the change is exactly. Then we're going to talk about a very important marketplace reminder. We are going to go into a known issue. We've shared it already, but we want to make sure that it's on everyone's radar and give you a space to also ask questions about it. We're also going to be talking a little bit about some members who have already gone through the renewals process and what exactly that means. We're going to talk a little bit about communications and outreach. And then I also just want to make sure that everyone's aware of the implementation report that we published earlier this year. And then we will have time for your questions. So hopefully that sounds good to you. And I want to respect everyone's time and make sure to get you out of here by noon Pacific time. And so let's dive in. So all the way back in 2021, which feels like so long ago, the Oregon legislature passed House Bill 3352. And what that did was expand Cover All Kids to include more adults within a $100 million budget. So that created a pathway to full Oregon Health Plan, also called OHP, and other medical assistance benefits like other long-term care supports, things like that, for more adults, regardless of their immigration status. And we say more adults because last July, when this program first launched, because we had to stay within budget, we did have limited age groups that were eligible. So it was people 19 to 25 and 55 and older. And I also just want to acknowledge how difficult it has been to tell people that, they weren't eligible because of their age. That's definitely something we've heard from community partners about how sad that was and how hard it was to tell people that. So I'm sorry you've had to do that throughout this last year. But no more, because as of July 1st of this year, the program opened to all ages. So people of any age or immigration status can now qualify as long as they meet all other eligibility criteria for full OHP benefits. And what that also meant, very similar to last year, is that all of the CAWA members ages 26 to 54, it's close to 40,000, they were able to move to full OHP benefits on July 1. And so overnight, they went from emergency coverage to full benefits. And also as of July 1, anyone interested in enrolling can now apply through the OHP application. So it's the same process. There isn't any kind of special application or special enrollment. It is exactly the same as anyone else who wants to apply for OHP coverage. And I would say in general, we have tried really hard. There's been so much work on the back end to make this, Healthier Oregon is OHP. And so the processes are the same. The eligibility criteria is the same. We really wanted to mirror this and just make it clear that Healthier Oregon is OHP. And because of that, we also recognize our system is a little bit complicated. So we would love your help in helping CAWA members, people who were CAWA members and had a marketplace plan, know that they do have to report that they now have those full OHP benefits to the marketplace. And I know it's something when somebody signs up for marketplace coverage, they're supposed to be, informed that if anything changes or if they get coverage, they need to report that. But we all know realistically, people forget, it's not at the top of their mind, all sorts of different reasons why they may not do this. And so, because an individual is no longer eligible for marketplace financial help, when they do move to full OHP benefits, it's really important that they report that to the marketplace. So if you have any members that you work with who used to be CAWA members, now have full benefits, also have a marketplace plan, please, please, please help us reach out to them. Help us confirm with them that they have reported this, because we don't want anyone to have to pay back the financial help they had while they were dual covered. And I would say that's just in general, like outside of Healthier Oregon. I know that you maybe have seen it. It happens. Maybe somebody got employer coverage, but whatever the reason is that they have some kind of full coverage, we want to make sure that they do report that to the marketplace so that they don't have to pay any of that financial help back. Unfortunately, the marketplace does not get updated about OHP benefits automatically. There's also not a report that we can run that tells us exactly who is in this scenario. I wish there was, but fortunately there's not. And there is only just that 1 month grace period that people have to report any new full coverage, in this case, full OHP benefits, from the date on the OHP eligibility notice. So we just wanted to take this opportunity to make sure that you were all aware of that. We have been including it in our messaging about the expansion, and so we're just trying to make sure that awareness is out there about this. So thank you in advance for any help you might give us in making sure people know about this. And then that known issue, I should have stuck to the bullet when in a previous slide when I said all CAWM members moved to full benefits on July 1, because unfortunately not all of them did. We do know about 1,600 of them who did not automatically move, and that is because something in their case needed updating. I've seen a few notes. Some people had a PIN, some people had an RFI that they needed to respond to. So different reasons, but something in their case made it so that they could not go through this automatic moving or transfer to full OHP. And staff have been working to manually resolve this and manually move people over to full benefits. I'm waiting on an update. I know the goal was to get all of those cases resolved by the end of July. Hopefully we'll hear back soon if we were able to do that, or exactly how many might be left. But thank you. I've gotten lots of emails from people reporting if they see somebody still has CAWM coverage, and please continue to do that. You can email me, or you can email your regional outreach coordinator, and they'll get me the information securely. Of course, we want to make sure that information is protected. But it's a huge help to have you let us know about this. It helps us see patterns where maybe there is another reason that we may not be aware of why somebody still has CAWM coverage. So it's really helpful. And again, you guys are eyes and ears and help us identify things we may not be aware of. But this one is a known issue, and I hope to be able to say that these have been cleared soon. And speaking of identifying patterns or trends, one that you all helped us learn about is this separate group. So this is a different group from the 1,600. So around 560 CAWM members didn't move to full OHP because they went through the renewals process already. And they were determined no longer eligible for benefits. So it could have been maybe they're over income, and so no longer eligible. And so their benefits were set to close either yesterday, the end of July, or at the end of this month, August. But they did have CAWM coverage on July 1st. So we've created a process so that these members would get their benefits extended for at least 60 days. And we did that to make sure that they receive enough notice and have time to use their full coverage. So again, members, these around 560 members in this scenario, we were able to extend their benefits for a little bit longer, at least 60 days, so that they can use their coverage and get notice. Now,
hey there.
Oh, yeah.
Hey, this is Donald Arrington. I'm a Medicaid policy analyst here.
I'm happy you're here. Hi.
Yeah, no, I just wanted to clarify when we say extending for 60 days, we're extending days from the point at which the staff is able to process the case. So because we weren't able to like fix these right away, we're still working through the list. So let's say the case gets processed today, right? The notice will provide at least 60 days of coverage from today's date. And because of the way that OHP gets closed, right, only at the end of the month, we are going to see people with more than 60 days. But the idea is once they get their notice in their hand, they should have 60 days or around 60 days from that point at which they're holding the notice. So I don't want people to think that like, oh, we extended someone from July 1st just to maybe August 31st. No, people are going to get extended until end of September, end of October because of this process.
Thank you so much for that clarification, Adonal, and for all your help with this. You definitely helped make this happen, so thank you for that. All right. Well, one other thing we wanted to flag for you is that members in these circumstances may get conflicting notices. As y'all know, sometimes notices are generated automatically, and so it's possible that members already got that closure notice or will be, and they may also get a notice saying that their benefits have been extended. And so we just wanted to make sure that this was also on your radars in case members reach out to you. And so please let them know that they can use their full OHP benefits until the new closure date listed on their most recent notice. So I'm sorry if this creates extra work for you, but again, we really appreciate any help that you might be able to give to members. Avoid this confusion. And if you have any questions, of course, reach out through us through the regular channels, regional outreach coordinators, or feel free to email me as well. We want to make sure that you're supported through this as well. And I am going to, oh, actually, we have one more slide, of course. One more thing we wanted to flag about this. So it's also very possible if these individuals did already get a notice that their benefits were closing, maybe they reached out to the marketplace and enrolled in a marketplace plan. And as we talked about in an earlier slide, people should not have both full OHP and marketplace coverage. So if this is the case, because this is a very special circumstance, members or you, their community partner, can request a retroactive OHP closure. So either the member can call One Customer Service or you as a community partner can call the CP Access line. So again, very special circumstances where maybe somebody wants to keep their marketplace plan. They don't want this OHP extension. And so we are able to help with that. Okay. And I'm going to pause here now because I know that was a lot of information. I'm going to let it sink in. And as Tanya mentioned, feel free to send us a question if you have it in the chat. We are going to have time for questions at the end, but I'm going to have an awkward moment of silence just to let this all kind of sink in and let you think of your question. And we will be sharing a copy of these slides. So this is not the last time you're going to see this or hear this. Did just want to mention that. Okay. All right. Let's talk a little bit about communications. So we have been really busy trying to get this good news out, the word out about this to state staff, to members, to external partners. Lots going on there. I'm also so grateful that we have our media grantee partner, Lara Media Services. They have helped update our outreach toolkit, and that's all for you. It has new flyers, posters, social media cards in 17 languages, and they're going to be adding to that. I know the next thing they'll be adding is a short 30-second video available in 27 languages, 30-second video in 27 languages that you'll be able to download and share on your social media channels or wherever you think will be helpful for people to have this information. In the toolkit, we also have message frames, sample captions you can use for social media, all sorts of different things. We absolutely welcome your feedback on any of the materials, on anything you'd like to see in the future. We have Lara Media as our grantee through June of 2025, so they're going to be around for a while, and we want to make sure that you have the tools you need to let people know about this opportunity. So please let us know. Feel free to email me, let me know, or let your ROC know, and again, they'll get it to me if you have any feedback or anything you'd like to see in the future in that toolkit. We've also updated our webpage and our FAQ documents that you can also find on our webpage in English and Spanish for the FAQ documents. We have some TV, radio, digital, and social ads that are going to start running soon. And then, of course, we will continue supporting you, work closely with you and our grantees. We do have Healthier Oregon grantees. And we want to support you so that you can support members. Again, we're so grateful that you are willing to do this. And we could not do this without you. So thank you, thank you, thank you for that. And as I mentioned earlier this year, we did publish an implementation report. I don't know if you've had a chance to look at that, but it does have a wealth of information about the first group of Healthier Oregon members. There's REAL-D data, so race, ethnicity, language, and disability. So just lots of really cool stories in there from members, from partners, from lots of different people. And then in case you don't want to read the full report, we do have a 2-page overview summary available in 30 languages. So the links are here, but they're also, again, on our webpage. On the right-hand side, you'll see a section that says Partner Resources, and you can find both the full report in English and Spanish and the overview summary there. And that was it for what I wanted to share, but I will open it up for questions now. Tanya, are there any questions that we've gotten?
I've been asked a couple of times if the slides would be shared, and just want to say that yes, they will be posted on group site along with the recording.
Awesome, thank you.
Yeah, and I think that's it for now.
Okay. Well, that's good. But we'll give it another minute or so. I want to make sure that you have ample time to think of your questions and ask them. I know you're all pros.
Oh, there's one question, and sorry for the person that I missed. Wondering for COWA members who didn't automatically transition to full OHP, what is their prime number we should report in the email? And Christy answered that case number would be fine.
Perfect. Thank you. Yeah, I've had both. I've mostly had people send over prime numbers, but a case number works as well. So thank you for helping us identify these members.
There's another question that I'll read off. There's a couple others that I might wait to see if folks on the policy team can respond in chat, or if they'd prefer to read out loud. But one of them is, can you please tell me if there's a time limit for this new program or law, full OHP coverage? Is it for a few years or for a longer time in Oregon?
Great question. So right now, and I would say, in general, with our OHA budget or different state budgets, we do have to have legislature approval. So as long as we continue to get that, then this program will continue. And, there's, I'm sure, lots of different ways to get involved in that if you're interested. But yeah, as long as we have the funding, we will continue this program. Thank you for the question. Any others?
There's another question asking if COWAM clients could qualify for marketplace plans,
Yeah.
or previous COWAM members.
Awesome question. So some CAWA members who had not yet, for example, it's possible that somebody had lawful permanent residence or LPR status, green card, those are different terms that are used, that haven't had that status for 5 years. And so before they were only eligible for CAWA and they were eligible for the marketplace. So there were some that had both. Great question, though.
I think there's a question in chat that has about a specific case. I might not read that one out loud, but someone from our policy team will help answer.
Awesome, thank you. And thanks to our policy team for being here. There is so much to track, and so I'm grateful that we have our experts to help us with that. And certainly, I want to be respectful of everyone's time. If we shared the information you were interested in, and right now you can't think of any questions, that's totally okay. Again, feel free to reach out later. We know they do come up, and we want to make sure to support you. And I just want to say thank you, from the bottom of my heart. And I know my team feels the same. You are all superheroes, and we appreciate what you do every single day for the people in your communities that you work with. I know they're grateful for you. I used to be an assister, and I remember, how people appreciated having someone that they could go to, someone that is from their community that they trusted. I think that relationship that you have with people is so special, and nothing else like it. So thank you for everything you do. I know it is not easy work at all, and I'm just so grateful for you. And we'll hang out for another few minutes, but feel free if, like I said, you got all the information you wanted right now, feel free to jump off, but we'll hang out for a little bit just in case you think of anything. I hope you have a great rest of the week and that August is amazing for you. Last month of summer, well, I guess September for a little bit, but I always think of August as the end of summer. So I hope you do something fun. Please practice self-care and make sure you're taking care of you. And thank you so much. Take care, everyone. Bye. And if there are any new questions, Tanya, feel free to ask them.
Yeah, there's one question that we're going to get soon. So the person asking about a Medicare patient, hang tight, we'll get to you.
Awesome, thank you.
There's another question that I'll read out loud. It's for people who are not allowed to be a public charge. Does application automatically catch this and disallow OHP or Healthier Oregon?
It does not, and I know that there is some confusion out there, some worries, certainly. It is on our webpage under our frequently asked questions. We did make sure to add that one because we know it does come up from time to time, but I do want to make it very clear that having OHP is not considered a public charge. Public charge can be pretty complicated also because it's not necessarily just one thing. I know they do look at the totality of the circumstances, as they call it. But yeah, no, people can be rest assured that having OHP is not considered a public charge. Now, we also include this question with a little more detail on our frequently asked document because there are certain services, very specific services, somebody getting care in a nursing facility, which could be considered public charge. Of course, it's not, again, guaranteed that it will be, but it is a very tiny sliver of services, but not the coverage itself. And we are not immigration lawyers. I definitely also want to say that. And so that's why we do point people, if they think they have a complicated immigration case or scenario, please reach out to an immigration lawyer, or the Oregon Law Center has a public benefits hotline where they can ask. We have a fact sheet also that we link to in the FAQ and document and the webpage section where people can learn a little bit more about that. But thank you for asking that question.
I think there's a question in the chat about reporting income that we're going to get to. So for the person asking, hang tight and someone will respond in the chat.
Thank you. About 11:32. Maybe we'll hang out till 11:35 if that sounds good to everyone. And then we'll end for today. But again, feel free to reach out if you think of something later. And thank you to the policy team answering questions in the chat. And also take the opportunity, if you hear any stories, from the people you work with that you want to share. I know we're always looking for those positive stories, or how this has helped people or changed someone's life. I know from time to time we get asked for those stories, and so having that on hand in case it happens, in case we get asked, would be helpful. I know I've heard some stories of, on Facebook. We partnered with TV Gem. I don't know if you've heard of them. They're an awesome news organization who really is well known and beloved by the Latino community. And I know they shared information, and it just was so heartwarming to see all of the comments and how excited people were about this change. So if anytime you have any members, clients that want to share their story, feel free to send them our way. Thank you.
Thanks, Maria. And there's one question that came through, just so you know that someone's answering it, and to keep the webinar open for a sec, please.
Oh, yes,
Just so we can get that answer.
Yes, will do. Thank you.
Thank you.
Thank you. I do see some people jumping off. We'll wait, but take care. So great to have you here.
There's a question from Susan in the chat that we're gonna, we can either wait a little bit, or we can get back to you individually. Susan, if you wouldn't mind putting your email in the chat, we can get back to you. I think that might be best, and we'll make sure to get you an answer.
Awesome. Thank you, Susan. Thanks, Tanya.
Thank you, Susan.
Are we good to end then, or should we hang out?
Give me 1 second to make sure I have the question written down, and then I think we can end it.
Perfect. Awesome. Thank you.
Yeah, okay. Maria, I think I've got it, so I think we're good to end.
Okay, awesome. Thanks, everyone. Please take care.
Thank you.
See you soon, I'm sure. Bye.
All right, bye.